And all of you familiar with the ISQ technology have seen different charts like this where we see that the higher the stability in terms of ISQ reading, the more aggressive, I guess you could use that term, we can be when it comes to loading implants or at least temporizing implants out of occlusion. And I've gone through the evolution of using the Osstell Mentor. The IDX was kind of like a neat little iPad, and it could connect online. And now what we're using is the Beacon, which is wonderful. It's small, it's convenient, it's wireless. And if you just want to record your readings, you attach your smart peg and you point the Beacon at the smart peg and you get your readings. But what I have started doing is using OsstellConnect and connecting that Beacon via Bluetooth to our desktop in the operatories. And we can enter all different kinds of patient data, and we can find our patients for follow-up measurements very easily. And for those of you who haven't seen it, I would strongly recommend you watch Will Martin's webinar on the Osstell.com site, because he does a beautiful job explaining how he's used this OsstellConnect in all different ways that you wouldn't imagine. And it's really been a very nice addition to what we're doing.